1. You have started work on a new ward. One of the patients allocated to you has been on the ward for the last 7 months since she had a cerebrovascular accident, CVA. You notice that her nursing care plan says strict bed rest, but on assessment, you cannot see any reason why this patient cannot sit out of bed for short periods. Your nursing action would be: A. Check with the other nursing staff the reasons behind the nursing care plan, then update the plan based on your assessment. B. Follow the nursing care plan strictly, as this would have been developed after a detailed and collaborative assessment. C. Seek physician's orders so that you have permission to move the patient. D. Try and move the patient without consulting with anyone to see how she manages. The answer is A. Check with the other nursing staff reasons behind the nursing care plan, then update the plan based on your assessment. 2. A nurse is making rounds taking vital signs. Which of the following vital signs is abnormal? A. 11-year-old male, 90b.pm, 22 rsp/min, 100/70 mm. B. 13-year-old female, 105 bpm, 22 rsp/min, 105/60 mm. C. 5-year-old male, 102b.pm, 24 rsp/min, 90/65 mm. D. 6-year-old female, 100 bpm, 26 rsp/min, 90/70 mm. The answer is B. 13-year-old female, 105 bpm, 22 rsp/min, 105/60 mm. 3. A patient who sustained a chest injury has a chest tube inserted which is connected to an underwater seal drainage system. When caring for this patient, the nurse will: A. Instruct the patient to limit movement of the affected shoulder. B. Observe for fluctuation of the water level. C. Clamp the tube when needed. D. Administer hourly analgesia. The answer is B. Observe for fluctuation of the water level. 4. The apical pulse can be best auscultated at the: A. Left second intercostal space lateral to the mid-clavicular line. B. Left second intercostal space at the left sternal border. C. Left fifth intercostal space at the mid-clavicular line. D. Left fifth intercostal space at the mid-axillary line. The answer is C. Left fifth intercostal space at the mid-clavicular line. 5. Which of the following actions is the most appropriate when the nurse is responding to a patient during a tonic-clonic seizure? A. Restrain the patient. B. Protect the patient from harm. C. Minimize noise and light stimulus. D. Apply oxygen by mask or nasal cannula. The answer is B. Protect the patient from harm. 6. An elderly patient is admitted to the hospital with swollen ankles. The best way to limit edema of the feet is for the nurse to: A. Restrict fluids. B. Apply bandages. C. Elevate the legs. D. Do passive range of motion exercises, ROM. The answer is C. Elevate the legs. 7. Which of the following actions is the most effective measure to reduce hospital-acquired infections? A. Double bagging of all contaminated laundry. B. Restricting visitors of infectious patients. C. Using disposable supplies. D. Correct hand washing. The answer is D. Correct hand washing. 8. A patient is diagnosed with diabetic ketoacidosis. The nurse would expect the physician to prescribe: A. Regular insulin 4. B. NPH insulin SC. C. Glucagon IM. D. Mixed insulin SC. The answer is A. Regular insulin 4. 9. The rationale for having the patient void before an abdominal paracentesis procedure is to: A. Minimize discomfort. B. Avoid abdominal distension. C. Prevent bladder puncture. D. Reduce infection rate. The answer is C. Prevent bladder puncture. 10. An 85-year-old man is admitted with dementia. He continuously attempts to remove his nasogastric tube. The nurse applies cloth wrist restraints as ordered. Which of the following actions by the nurse is most appropriate? A. Evaluate the need to restrain by observing patient's behavior once every 24 hours. B. Perform circulation checks to the extremities every 2 hours. C. Remove the restraints when the patient is sleeping. D. Instruct family to limit physical contact with the patient. The answer is B. Perform circulation checks to the extremities every 2 hours. 11. During balloon inflation of an indwelling urinary catheter, the patient complains of pain and discomfort. The nurse should A. Continue the procedure and assure the patient. B. Aspirate the fluid and remove the catheter. C. Withdraw the fluid and reinsert the catheter. D. Decrease the amount of injected fluid and secure. The answer is C. Withdraw the fluid and reinsert the catheter. 11. A patient is to receive 25 mg per hour of an aminophylline infusion. The solution prepared by the pharmacy contains 500 mg of aminophylline in 1000 ml of D5W. How many milligrams are available per ml? A. 0.25 mg per ml. B. 0.5 mg per ml. C. 1 mg per ml. D. 2 mg per ml. The answer is B. 0.5 mg per ml. 13. A patient has had a total hip joint replacement. Which of the following actions should the nurse consider for the patient's daily recommended exercise program? A. Administering an analgesic before exercising. B. Discontinuing the program if the patient dislikes it. C. Continuing exercises in spite of severe pain. D. Evaluating effectiveness of exercise based on pain scale. The answer is A. Administering an analgesic before exercising. 14. Whilst recovering from surgery, a patient develops deep vein thrombosis. The sign that would indicate this complication to the nurse would be A. Intermittent claudication. B. Pitting edema of the area. C. Severe pain when raising the legs. D. Localized warmth and tenderness of the site. The answer is D. Localized warmth and tenderness of the site. 15. Which of the following techniques should the nurse implement to prevent the patient's mucous membranes from drying when the oxygen flow rate is higher than 4 liters per minute? A. Use a non-rebreathe mask. B. Add humidity to the delivery system. C. Use a high-flow oxygen delivery system. D. Ensure that the prongs are in the nares correctly. The answer is D. Ensure that the prongs are in the nares correctly. 16. Extrapyramidal adverse effects and symptoms are most often associated with which of the following drug classes? A. Antidepressants. B. Antipsychotics. C. Antihypertensives. D. Antidysrhythmic. The answer is B. Antipsychotics. 17. A construction worker was brought to the emergency department and admitted with the diagnosis of heat stroke due to strenuous physical activity during hot weather conditions. Which action should the nurse take? A. Immediately immerse the patient in cold water to reduce the patient's temperature. B. Administer an antipyretic such as aspirin or acetaminophen. C. Place ice packs to the neck, axilla, scalp and groin. D. Encourage foods and oral fluids that contain carbohydrates and electrolytes. The answer is C. Place ice packs to the neck, axilla, scalp and groin. 18. The nurse should observe for which of the following symptoms in a patient who has just undergone a total thyroidectomy? A. Weight gain. B. Depressed reflexes. C. Muscle spasm and twitching. D. Irritable behavior. The answer is C. Muscle spasm and twitching. 19. Which of the following indicates the nurse is engaging in a therapeutic nurse-patient relationship? A. The nurse establishes a relationship that is mutually beneficial. B. The nurse demonstrates sympathetic feelings toward the patient. C. The nurse commits to helping the patient find ways to help self. D. The nurse utilizes therapeutic touch to convey acceptance of the patient. The answer is C. The nurse commits to helping the patient find ways to help self. 20. One factor affecting the pharm kinetics of older patients' drug absorption is A. Decreased gastrointestinal motility. B. A difficulty in swallowing. C. A prevalence of obesity. D. Numerous medications. The answer is A. Decreased gastrointestinal motility.